My name is Dr. Alyx Rosen-Aigen, and I'm an assistant professor of dermatology at the University of Miami Dr. Philip Frost Department of Dermatology and Cutaneous Surgery. I'm going to give you some ideas to care for your acne during the time of COVID-19 when we're all wearing personal protective equipment or PPE. Dr. Jonette Keri and I came up with some quick tips to help you fight acne that you may be experiencing. For acne on the face or trunk, remember that anything that irritates the skin can potentially make the acne worse. The goal should be threefold. First, to cleanse, then to treat, and to protect. All the while watching to make sure that you're not irritating your skin. So the first thing you want to do is start with a cleanser that's used to treat acne, such as one that has glycolic acid, salicylic acid, or benzoyl peroxide. In general, the glycolic acid or salicylic acid cleansers are less irritating, but are a little bit weaker than the benzoyl peroxide containing washes. If you classify yourself as someone with sensitive skin, you want to stick to the washes that have the acids rather than the benzoyl peroxide. You want to make sure that you wash your face twice a day. This has actually been studied in acne patients, and twice a day washing is best. Do not overwash or scrub the skin, as again, this can make things worse. Also remember that you can use the same acne products on your chest and back that you use on your face. Sometimes the products that are meant for the body come in larger sizes so that you can use them on a larger surface area. You should also shower as soon as you get home and wear loose-fitting clothing. The loose-fitting and moisture-wicking clothing is good for truncal acne during those long days at work. So it's important, if you're wearing scrubs, consider wearing something that wicks the moisture away underneath your scrubs during the day to avoid or help your truncal acne. To give you a few examples of some cleansers, I have really no preference per se, but ones that you can find in the drugstore if you're going out, or that you can order online from Walmart or Walgreens online. So the first one is a different cleanser, and this one actually has 5% benzoyl peroxide. So if you're gonna find a benzoyl peroxide containing wash, look for one that has between 3 and 5%, as that one will be less irritating. The Neutrogena cleanser has salicylic acid. You can find this in almost any drugstore. There's the original one, or ones that have scents like grapefruit. And then Glytone makes a mild cream cleanser, which has glycolic acid, and so it's really nice for sensitive, prone skin. If in the beginning your skin is too sensitive and too irritating while you're using these cleansers, you might want to consider decreasing the frequency that you're using these acne-fighting cleansers and rotating them with cleansers that are meant for more sensitive skin. So I also have options for that. So the first one is a gentle cream cleanser from Vanny Cream, and this one I recommend for all patients who have very sensitive skin. The next one is a CeraVe hydrating cleanser, and this one's really nice on sensitive skin, so you can use these 2 to 3 days during the week when you're not using your acne washes. And then two other options are the La Roche-Posay Purifying Foaming Cleanser, or the hyaluronic acid containing Hydro Boost cleanser from Neutrogena. And this one's really nice because the hyaluronic acid will help absorb some moisture and help kind of hydrate your skin. So for treating after you've cleansed, sulfur-containing lotions or creams, as well as benzoyl peroxide-containing leave-on products can work as well as over-the-counter retinoids such as adapalene or Differin. These are fine, but they can be irritating at the beginning of treatment within the first few weeks. So you may want to avoid starting these products while you're wearing your personal protective equipment. Another option is to use these topical treatments only 2 or 3 times a week again, and increase as your skin becomes tolerant of them. So one option for the leave-on product that has benzoyl peroxide is the Rapid Clear Stubborn Acne, and this has 2.5% benzoyl peroxide. And the Differin gel or adapalene is 0.1%, and this is the only over-the-counter retinoid that you can find, which is really good for acne. And the way that we recommend using this is you use a small pea-size amount, and you apply that all over your face, a small amount. So don't use a ton each application, and you put it on at night. Now, after you've cleansed and treated your skin, you need to protect it. This is probably the most important step when wearing a mask. Think of moisturizer as a barrier between your skin and the mask. And a bland moisturizer can do the trick, one without any fragrance that's meant for sensitive skin. A favorite of ours when the skin is irritated, perhaps let's say from an N95 mask, is to use a layer of petrolatum. Vaseline is a dependable brand of petrolatum. It's not expensive and most people have it at home. And believe it or not, petrolatum is non-comedogenic and doesn't clog pores. Moisturization is especially important at night as it can help heal the skin overnight. And if you don't want to use an ointment-based product like petrolatum, other options that you can find in the drugstore online are, again, Vani cream. This one is the moisturizing skin cream, so it's a nice thick cream. And then another option is the Cetaphil Rich Hydrating Night Cream, and this one also has hyaluronic acid, and so I really like this one. If acne gets bad or you're having pain from your lesions, consider calling a dermatologist for a telederm visit, as a course of antibiotics can help. If you notice any skin breakdown or if you have any ulcerations or open wounds, it's also really important that you reach out to your dermatologist and not pick the areas so as to avoid any sort of superficial skin infection, which can lead to even worse outcomes. One last pearl from Dr. Keri is that sugar makes the acne worse. So you want to make sure that you're watching your intake of sugar, especially in sugary drinks. That's not to say that at the end of a long day, you don't deserve a sweet treat, as we all know everyone's working really hard. And finally, just want to say, take care of everyone. Thank you to all of the healthcare professionals and anyone who's on the front line taking care of these patients in the hospital. We're really appreciative of everything you're doing. And we want you to know that your dermatologists are aware of all of the skin problems that are going on and that we're available for you if you need us or you need anything. If you'd like to make an appointment with one of the dermatologists at the University of Miami, you can call 305-243-6704. We're available for teledermatology consults every day of the week. If you have any questions, please feel free to reach out to one of us. Take care.